Night Fighters Syringe Exchange Program Plan, presented by Rebecca Murphy. Program Design. The chosen name will be Night Fighters, Syringe Exchange Program for IDUs in Bucharest, Romania. Night Fighters will operate out of a chosen HIV/AIDS clinic between the hours of 5 a.m. and 5 p.m. to avoid social stigma. We'll dispense 10 syringes and an instructional coupon in a discreet baggie. Program Timeline Year 1. Obtain 20 local volunteers from Bucharest to participate in the 3-year program. Purchase and allocate paper bags 1,000 syringes. Research and find a functional and well-known HIV clinic willing to participate and split the cost of rent due to overnight operational increased costs. And also hold weekly one-and-done syringe classes to jumpstart the program. This will increase the word of mouth. Program Timeline Year 2. Diminish the amount of instructional one-and-done syringe method classes to a monthly basis. Allocate an increased 125,000 syringes and instructional one-and-done coupons. Also, train new volunteers if necessary due to turnover rates. Program Timeline Year 3. Continue with volunteer-led monthly instructional one-and-done syringe method classes. Allocate 125,000 syringes and one-and-done instructional coupons. On a regular basis, hand out 5-question surveys to customers in order to obtain success measures from the Night Fighters program. Program Implementation. Local volunteers can provide cultural understanding for the program. 5 a.m. to 5 p.m. operation times will diminish social stigma for IDUs as well as increase the use of the program. Paper bag utilization for syringe allocation will provide discrete and also multifunctional, as they can dispose of the syringes in the same bag. Program Implementation. One-and-done syringe method classes and coupons will increase program usage, and will also prevent the spread of disease. These will be mostly pictures to take into account the illiterate. Use of HIV/AIDS clinics as housing will increase community interaction with healthcare professionals they would otherwise not have access to, as well as provide a place for testing. Night Fighters 3-year goals. Number 1 is to allocate 350,000 syringes to IDUs in Bucharest. Number 2 is to create a lasting relationship between the patrons of the program and the HIV/AIDS clinic healthcare workers. Number 3 will be implement the one-and-done syringe methods among the patrons of the program. And number 4, ultimately reduce the number of new HIV cases within Romania by 0.1%. Monitoring. This will be done on a monthly basis. Will be directed from the attendance of the monthly educational classes, as well as by the amount of syringes allocated and returned, which will be recorded on a spreadsheet by volunteers of the Night Fighters program. The number of people getting tested done at the clinic and new cases of HIV/AIDS will also be evaluated. Evaluation will be done on a monthly basis using a survey. The survey will include 5 questions, and these will include: does the Night Fighters program prevent you from sharing needles with others? Yes or no? Do you feel you have a safe place to seek care or services by visiting the HIV clinic to obtain syringes? Yes or no? Have you used the Night Fighters program more than 5 times in the last month? Yes or no? Have you attended at least one educational syringe class? Yes or no? And does one-and-done syringe method help you prevent the spread of HIV? True or false? The survey method will be 5 questions, which is easily completed while online for the exchange. This is to be completed monthly by at least 100 people, and will be used to assess the program for minute changes on a monthly basis. Sustainability. One-and-done educational coupons will ensure the syringe methods will be carried out in the future. Constant monitoring and surveying will ensure the program is as beneficial as possible and could continue with further funding based on success. Providing an ongoing relationship with the clients of the program and with the healthcare professionals will ensure the sustainability of the program as well. The budget for year 1 of Night Fighters is as follows. 30% or $15,000 will be allocated towards supplies, paper bags, and the educational coupons. 30% will be going towards rent, the overnight cost of the HIV/AIDS clinic, 20% for volunteer testing, and 20% for syringes. Year 2 is much like year 1 in that 30% is going towards supplies, 30% towards rent, 30% for each increased number of syringes, and 10% for training. And the 10% in training will be set aside in case Night Fighters needs to retrain new employees due to turnover. Thank you.